Good day, everyone. My name is Dr. David Ejenobo. I am a consultant obstetrician and gynecologist here at Nisa Premier Hospital, a fellow of the West African College of Surgeons, and a member of the Royal College of Obstetricians and Gynaecologists, London. Fibroids are abnormal growth of the smooth muscle cells of a woman's uterus, also called the woman's womb. If you take a look at my model here, this pear-shaped organ represents a woman's womb, while the red inner area here represents the smooth muscle cells of a woman's womb. And fibroids grow individually from these muscle cells when they are developing, and they grow in a circular manner within a capsule, and they are quite firm. They do not lead to cancer, but they distort the womb structure. They can make it quite big. They can affect the inner lining of the womb and cause problems in the womb. Very, very rarely do they cause cancer, but otherwise they are just, large, and they compress various areas of the womb and outside of the womb as well. They can arise in any position, from within the cavity where the baby stays, within the wall of the womb, or outside the wall of the womb, and they can extend to any region and any part of the womb, from the top to the bottom. So fibroids develop from individually. Each fibroid develops on its own, and whether more are going to develop over time, nobody knows. We don't know exactly why these fibroids develop, but we know that they are quite common in black women. A lot of women would have fibroids as they age, so it is likely to be more common amongst older women than younger women, but it can also occur in younger women. Fibroids tend to grow individually and at different rates. So for some, the fibroids can occur small and then grow very slowly over a long period of time, while for others, they grow faster and can be quite large, even within a short period of time. So we tend to classify the fibroids according to where they occur within the wall of the womb. They can occur within the cavity of the womb where a baby is supposed to stay, or where menstruation occurs. And they can occur within, and they are normally called the submucous fibroids. They can occur within the wall of the womb, grossly stretching out the wall of the womb. And these ones are called the intramural fibroids. They can also occur outside the womb itself, but attached to the body of the womb. And some can even be attached by a stalk. And these are called subserous fibroids or pedunculated fibroids. Fibroids cause problems majorly because of their location and their size. On the womb itself, the fibroids that are located within the cavity of the womb can lead to heavy bleeding, and women can bleed quite a lot from these kind of fibroids, that to the extent that they are short of blood and they can require blood transfusion from time to time. Fibroids can be so big that they compress other organs like the bladder, where urine gathers in order for a woman to pee, causing the woman to have frequent urination, or the rectum, where poo gathers and it can cause difficulty with passing stool. They can also compress some other intra-abdominal organs as well when they are really large. But for most women, the fibroids do not cause any problems. So fibroids can be detected based on a woman's complaints, or they can be found incidentally on routine checkups. Whenever a woman comes to complain of heavy menstrual bleeding, one of the things we look out for is fibroids. When a woman comes to complain of chronic lower abdominal pain, one of the things we also look out for is fibroids. But ordinarily, fibroids do not cause problems, and they usually go unnoticed unless the woman has gone for a routine checkup and during an ultrasound scan they have found out that the woman has got fibroids. Treatment of fibroid depends on what the fibroid is causing, the problems that the fibroid is causing for the particular woman. If there are no problems and the fibroids are not large, for majority we recommend absolutely no treatment. This does not mean that the fibroids will not grow, but unless they become a problem, we still do not recommend any treatment in those cases. The fibroids that cause problems of heavy bleeding and pain or compression of other organs are the ones that require treatment. The treatments include medicines that help to control the symptoms. For example, the heavy bleeding, we have drugs that can help to reduce the amount of bleeding. We also have drugs that can stop the cyclical pattern of menstruation so that the woman bleeds less often, or we can also create what is called a medical menopause, where the woman does not have a menstruation for a particular period of time. These measures only give temporary relief to the symptoms because they do not permanently solve the problem. Some women have in error patronized other alternative treatment like herbal treatments that have offered promises of making the fibroids shrink and disappear. But in clinical practice, we have not found that to be so. Most of these medical treatments, they prevent pregnancy, and for women that are trying to get pregnant, these may not be suitable. Or for those that are not trying to get pregnant, that are willing to cope with this prolonged use of medication, sometimes we can place them on these medications for a particular period of time to achieve some particular control. For example, to help the woman to build her blood while preparing for some definitive kind of treatment. The mainstay of fibroid treatment in our environment is usually an operation to either remove the fibroid if the woman still wants to conceive, or to remove the womb if the woman has completed her family size or no longer wants to have more children. The operation to remove the fibroids is in a bid to protect the womb for future reproduction, as to have kids in the future. And this surgery is called myomectomy. And this will be recommended for women that have significant symptoms and still want to have more kids. Removing the womb is the option that we give to women who have significant problems but do not want to have any more kids. The difference between these two procedures is that while one preserves the womb, it also gives room for fibroids to reoccur later in the future, while the other one that removes the womb solves the problem permanently, because once the womb has been removed, the fibroids cannot come back again. So leaving the womb still leaves room for fibroids to come again in the future that will require more treatment. There are other non-surgical treatments for fibroids, but before the non-surgical one, we also have minimally invasive treatments for fibroids, depending on the location and the size of the fibroids. This we call hysteroscopic surgeries to remove fibroid that is within the cavity of the womb that may be causing heavy bleeding or affecting the cavity of the womb, preventing pregnancy. Or laparoscopic surgery, where we make just minimal incisions, and through that mechanism we are able to bring out the fibroids. All these options of open or minimally invasive surgical treatment for fibroids are very safe, and they are available at our hospital. The non-invasive ways of treating fibroids are based on radiological intervention. That means these are procedures carried out by radiologists. This includes injecting drugs or substances that block the blood supply to the fibroids, called uterine fibroid embolization, or using high intensity ultrasound to destroy the fibroids. However, these are not very common in our environment, but with advancement, hopefully we'll have more of these and make them more available. Yes, like I said, fibroids arise from individual cells of the wall of the womb. These cells are replaced from time to time, and new ones come. When a new one is coming, it may lose its regulation and eventually become a fibroid. So that we've removed the ones that are present does not mean that new ones will not come, as whatever has triggered the old ones from coming can also trigger new ones from coming, and can also trigger the formation of new ones. Therefore, fibroids do tend to reoccur quite commonly, especially in black women. Yes, fibroids can affect pregnancy based on their location. First of all, it can prevent pregnancy if it is located within the cavity of the womb where a baby is supposed to stay. And these are the ones that are called submucous fibroids, because they affect areas of the womb where the fetus is supposed to implant, thereby preventing pregnancy. And removal of these fibroids tend to improve chances of conception. Some can stay in areas where they compress the tubes and occlude them, preventing fertilization and pregnancy from occurring. So in these two ways, they can prevent pregnancy. If a woman gets pregnant with fibroids in the womb, the fibroids can cause pain in pregnancy, also known as red degeneration, and this can lead to frequent cramps and sometimes can lead to miscarriages. although majority of women that have fibroids with pregnancy will do very well, and although they may have little problems here and there, they are very manageable and they are likely to do very well. Towards the time for delivery, large fibroids can affect the position of the baby and make it difficult for the head of the baby to come down to the pelvis where the baby is supposed to be delivered through. And in this kind of situation, a cesarean section may be needed for delivery. At delivery, fibroids tend to affect the way the womb contracts and can also lead to heavy bleeding after delivery. We have measures to prevent this from happening, and they are always employed when we know that a woman has fibroids and she is having a baby. So fibroids can be quite a big problem in our women. It's a problem of black women, and many women are afraid of treatment of fibroid, especially treatment of fibroid to conserve the womb for the purpose of having more babies in the future. Many women are concerned about if they will be able to give birth again after they have removed their fibroids. Many women are concerned about bleeding and losing their womb as a result of fibroid operation. Some women are concerned about the safety of fibroid operation, whether or not they would live or die. And I want to use this opportunity to say that at Nisa Premier Hospital, fibroid operations are carried out very regularly and are very, very safe. We know that there might be complications surrounding fibroid operations, but we have measures to prevent them from happening. For example, we have things to prevent scarring, excessive scarring from fibroid operation called anti-adhesion barrier, which we use during our surgeries. We would recommend that any woman that has fibroids that are causing significant problems can come to us, get evaluated. Sometimes these can be amenable to minimal access operation, and sometimes it has to be by open surgery. But whatever it is, it will be done safely and with good outcome. So I'm trying to use this opportunity to say that it's not something to be afraid of. If you have fibroid problem out there, come and get treatment at Nisa Premier Hospital.